So let's start with dermatology. The first question they've asked about the mineral deficiency which leads to this condition. So this condition is acrodermatitis enteropathica, and zinc deficiency causes this condition. Iron deficiency causes anemia, and copper deficiency causes Menkes disease, and it is due to ATP7A gene mutation. So what happens if this A becomes B? Which disease is that? It's Wilson's. So, next question. A 45-year-old male came with complaints of ulcer on the anterior surface of the leg. So, he has a history of ulcerative colitis. And what is the diagnosis? So, now when we see the image, it has a purple border, and the floor is a bit deep when compared to the border. So it is typical appearance of pyoderma gangrenosum, and it mostly happens in case of IBDs. So this becomes the straightaway answer. And for the other options, this is erythema migrans, which commonly happens in Lyme disease. And in this, the rashes are of target like appearance. We can also call it as bullseye lesion. And this is erythema marginatum. It happens in acute rheumatic fever. And in this, the rashes occur mostly on the trunk. And these are non pruritic rashes. And other erythema rashes are erythema nodosum and multiforme. Erythema nodosum happens in infections, autoimmune conditions, pregnancies, neoplasms. And multiforme most commonly happens in HSV and also because of some drug reactions. So, yeah, in this question, the answer is pyoderma gangrenosum. Next question. A 76-year-old female presents with a mole of irregular border and diameter more than 8 mm. So, the image is given and they've asked to identify the diagnosis. So, the diagnosis is malignant melanoma, and we all know there's this A, B, C, D, E criteria. A stands for asymmetry, and B stands for border. And border as in irregular. It should be irregular. And for C, it is color. It should have multiple colors like shades of brown or reddish, like that. And diameter more than 6 mm. So in this question, it's given as 8. So obviously, it's in line with our diagnosis. And also evolution. Evolution, as in it starts as a small mole and later becomes into this ugly looking lesion. So, yeah, the diagnosis is malignant melanoma. And for the other options, this is Becker's nevus. It is a brown patch which occurs on the shoulder area. It also has hair and acne in this region. Uh, so, this is BCC, and BCC mostly happens in sun exposed areas such as face, and these lesions are also quite easy to identify as it has a raised border, and we can also see telangiectasia. So if this image is given, you can easily identify it as BCC. So on the as far as other nevus are concerned, this is nevus of Ota. Ota looks like an eye. So the nevus which happens around the eye is Ota. And Ito is a blue patch in the shoulder, and Ota is also a blue patch around the eye. Let's go to anesthesia now. So here they've asked about the commonly used nerve to test this. So what test are they talking about? Test the function of neuromuscular junction. A peripheral nerve is stimulated electrically and the response is assessed at the time of extubation. So which nerve are we using? The answer will be ulnar nerve, and the muscle most commonly used is adductor pollicis. So this device looks like this, and with this we measure the response. And the second most commonly used is facial nerve, and the muscle used is orbicularis oculi muscle. The superficial nerves are most commonly used. So the answer here will be ulnar nerve. Next question. They've asked about the color coding of the cylinder. So when you glance at the question itself, you can see oxygen. So they've asked about oxygen color, oxygen cylinder's color, and we know it is black body and white shoulder. This is the answer. And we will also see about other cylinders. So in this picture, you can see black body and white shoulder. So this is oxygen, and here it is fully blue, and that would be N2O. And here you can see black body and black and white shoulder. So this will be air. And here we see blue body and blue and white shoulder, and that is Entonox. And here fully it is gray, that's CO2. So we have a pin index safety system, commonly called as PIS, and this is used to connect the correct cylinder to the machine to avoid any accidents. And here they have mentioned numbers according to the gas used, and we have to memorize all that. So this is how the pins look like, the holes in which we connect. So this is the list which we should remember. For air it is 1,5, for oxygen it is 2,5, and N2O it is 3,5. For carbon dioxide we have two numbers, 1,6 and 2,6. If it is more than 7.5 it's 1,6, and less than 7.5 it is 2,6. For cyclopropane it is 3,6, and cyclopropane the cylinder color is orange, and Entonox the number is 7. Next question. All the following can give false low pulse oximeter values except. So in this, when you look at the options, everything gives low pulse oximeter, false low values except carboxyhemoglobin, which gives false high. And this is the pulse oximeter which we commonly use nowadays. Here, infrared light waves are passed, and the sensors which are in the pulse oximeter detects how much oxygen is present in the blood based on the infrared rays which is passed in our fingers. So we have a list of conditions which we should remember for false low, false high, and no change in pulse oximeter values. False low, we have two meths, methemoglobin and methylene blue, and shock and shiver. And finally, you should remember the nail paints, the dark colors like black or brown. These all give false low values. And in false high, we have only one value, carboxyhemoglobin. So this is very important to keep in mind. And in no change, we have the skin color. Like dark skin color people also will have the same readings. There will be no change. And different hemoglobins like fetal hemoglobin or sulf hemoglobin have no change in the values. And excess of bilirubin also does not affect, and henna also does not affect the pulse oximeter readings. Okay, now let's see about the radiology questions. So first, they've given a CT image, and the question says 77-year-old male presents to the ER with complains of severe headache, and he describes it as the worst headache of his life. So we should find out the diagnosis. And we are able to see the blood in basal cisterns and the worst headache. Both of these point towards our diagnosis, which is SAH. And for other options, this is EDH. In EDH, the shape is biconvex, and the artery involved is middle meningeal artery, and biconvex looks like idli. So EDH, idli. It's a way to remember. And subdural hematoma, it's concavo-convex in shape, and it looks like a banana. So the next option is the intracranial hemorrhage, and it's mostly due to hypertension, and the area affected is putamen. So it mostly affects the middle cerebral artery, and mainly their branches, which is lenticulostriate branches. In subdural hematoma, the bridging veins are mostly affected. So the next question. 40-year-old man was brought to the hospital after a road traffic accident, and he has bradycardia and hypotension. Chest x-ray is shown. They've asked about the diagnosis. So in the chest x-ray, we can see that there is a mediastinal shift, and deep sulcus sign is seen, along with an unstable patient. With all these three, we can come to a diagnosis of tension pneumothorax. In tension pneumothorax, it's mostly managed by needle thoracostomy, and it is followed by intercostal drainage, which is the definitive management. So, next, the question just says identify. So, you should see the image, and here, first, you have to understand what's happening. So, these are the bowel loops, and the bowel loops are communicated to the chest. So, which this means that the barrier in between, which is the diaphragm, is damaged. And when you look at the options, only one question has a diaphragm involved, which is congenital diaphragmatic hernia, and that becomes the answer. And pneumothorax you just saw in the previous question. And pneumoperitoneum, you'll be able to see air somewhere over here, like here below the diaphragm or here. That becomes pneumoperitoneum. So in this question, it's hernia. Next. This one also straightforward question. They've asked to identify the mark structure. And here the mark structure is cerebellum. So first we'll see images. So in this cut section, we are able to clearly appreciate the midbrain, pons, and medulla. And the cerebellum is placed posteriorly. So in the midbrain, the cross section where midbrain is present, we'll be able to appreciate cerebral aqueduct and third ventricle. In the cross section where pons is seen, the bones are more clearly seen along with the cerebellum. And as far as medulla, we'll be able to see the foramen magnum, and cerebellar tonsil, part of it will be visible, but not much. So whenever pons is there, cerebellum becomes more visible. So in this question, the answer is cerebellum. The mark structure is cerebellum. So next question. A 23-year-old male was brought to ER after RTA. He was unconscious with external injuries. CT brain was normal. This is a diagnosis clincher. So they've asked about the diagnosis. In all these conditions, there will be abnormality seen in CT brain, except for the diffuse axonal injury. And when shearing force is applied to a moving object, then there is a damage to the axons, which is not clearly seen on the CT scan. But sometimes in the CT scan, we'll also be able to see petechial hemorrhages, and mostly they'll be present on the gray white junction. Other than that, CT will be normal. So, if you want to make a clear cut diagnosis, MRI can be done to diagnose this condition, diffuse axonal injury. So, in this question, answer is C, DA. So, next is psychiatry. 45-year-old depressed man becomes clingy and tearful when his wife visits him. He adopts a fetal posture and sleeps on her lap. Which of the following is exhibited? Repression, sadism, retardation, regression. So, from the given features, it looks like regression. In regression, the patient goes back to earlier stages of life, so and becomes like a child. A similar sounding word is repression. In repression, the patient voluntarily forgets the depressing thoughts or emotions and feelings from the conscious mind. So here the answer would be regression. Next. A 16-year-old female presents with over familiarity, flight of ideas, elevated mood, increased sexual desire. So they're asking the diagnosis. So here it becomes easy. The answer is mania. But if hypomania is also given in the options, then we'll need another information from the question. What is that? That's nothing but the duration. For mania, to diagnose it, we need the symptoms to be persistent at least for more than or equal to 1 week. And hypomania, it's just 4 days. And when you look at the other options, cyclothymia is just the opposite. And here there is persistently low mood for at least a period of 2 years. So here the answer is mania. Next. A 60-year-old male was brought to ER with complaints of restlessness, and he was recently started on antipsychotics. So he's also taking for other comorbidities. And which of the following can be used to treat this particular condition? So from this line itself, we can very well see that the condition is due to the side effect of the antipsychotic medications, and restlessness is mostly seen in akathisia. So this is the most common extrapyramidal side effect of antipsychotic medications, and for akathisia the treatment is propranolol. When you look at the other options, dantrolene is used in the treatment of neuroleptic malignant syndrome. Benzhexol is used in the treatment of Parkinsonism induced because of the antipsychotic medications. And valbenazine is used for the treatment of tardive dyskinesia. In this, we'll see orofacial abnormalities. So here the diagnosis is akathisia, and for the treatment we use propranolol. That becomes the answer. Next is orthopedics. So it's a big history. 11-year-old male came to hospital with 3-week history of pain and swelling of thigh along with fever. So obviously they have diagnosed as osteomyelitis and treatment was started with antibiotics but no relief. So this means osteomyelitis is not the diagnosis. So later X-ray was done which revealed lamellated periosteal reaction and karyotyping showed translocation of 1122. What is the most likely diagnosis? So given options are osteomyelitis, Ewing sarcoma, enchondroma and osteosarcoma. So out of these osteomyelitis is ruled out already. So lamellated periosteal reaction means onion skin appearance. So I think this will ring a bell. And karyotyping also shows translocation 1122. This is most important point in diagnosing of Ewing sarcoma. So that's the answer. So When we see about the other bone tumors, we have simple bone cyst, aneurysmal bone cyst, and giant cell tumor. In simple bone cyst, there is a fallen fragment sign, which is nothing but a fragment of bone will fall into the cyst and it will be seen as a density in the cyst. So that's called as fallen fragment sign. And between aneurysmal bone cyst and giant cell tumor, there are certain subtle changes which will give us the diagnosis. In aneurysmal bone cyst, the physis will be will not be closed; it will be open, and which means that the age is very young. But in giant cell tumor, the physis will be closed already, and since it happens below the physis, this is the metaphyseal region. Aneurysmal bone cyst happens only in the metaphyseal region, whereas GCT happens in epiphysio-metaphyseal junction. So, other than this, when you look at the image, it will appear similar, but there are these subtle changes which are worth noting. So, here we can see the sun ray appearance, which gives away the diagnosis of osteosarcoma. And here you can see a stalk and a cap. So, this is osteochondroma, which has a bone and a cartilage component. So, next question. A 14-year-old short, stout, sexually immature male was brought to the hospital because of limping and abnormal gait. There was increased external rotation at the hip joint, and X-ray shows Trithoven's sign. What is the probable condition? So there are many diagnostic clinchers in this particular question. One is the Trithoven's sign, and short, stout, sexually immature male itself is a very big clue for us. So the answer is SCFE. So we should know the difference between these three, and it will be very helpful to diagnose these three conditions if it comes in the exam. So first, developmental dysplasia of hip, then leg Carvey-Perthes disease, then SCFE. So in DDH, mostly the patient's age will be in months, whereas in leg Carvey-Perthes it will be around 4 to 9 years, something in that range. And in SCFE, it will mostly be in the pubertal age group, 14 years. So from the first line itself, we can come to a conclusion about the diagnosis. And other things like skin crease will be mentioned. In the thighs, the skin crease will be abnormal in case of DDH. And the gait will be of lurching gait. And in leg Carvey-Perthes, there will be a limping or antalgic gait, and in the history they would have given that the boy or girl is not able to do cross leg and has difficulty in sitting down. Some sort of history like that will be given. And in SCFE, as given in our question, it will be short, stout, sexually immature, pubertal age group history will be given. Sexually immature. So with this, we can easily differentiate between these three conditions. The next question, they have given this splint. This is a cock-up splint. So when do you need a cock-up splint? Only when your wrist is dropped down, you need something to keep it up. So wrist drop happens mostly because of radial nerve damage. So this injury leads to wrist drop, and we need a cock-up splint for that. And ulnar nerve injury causes claw hand, and claw hand means there will be extension at the metacarpophalangeal joint. So we need a knuckle bender splint to correct that. Ulnar nerve damage.